we're moving you through some exercises. You're probably wondering what we're doing and where we're going. There is, quote unquote, method in the madness. I'm just going to go back and explain, so what are we trying to accomplish? We're trying to integrate into this process an understanding of self, other. We probably won't get to other with a capital O. And that what we learned is that we all believe we understand relationships, but there's a whole skill set, there's a whole philosophy, there's a whole theoretical framework about relationship. So the very first exercise in terms of we call it the name game, where you actually tell somebody on your team who your name is. And it might seem quite ridiculous because you've been working together, but we've worked with over 75 teams in a variety of healthcare situations: rehab, residential care, acute care, emergency, intensive care. We've worked with teams and teams within teams throughout healthcare. And often when we start, and we usually start with what we call the name game. Why? Because one of the things in terms of the hurt piece is people say, I've worked with that doctor for 5 years and he or she doesn't know my name. That's one of the hurts. We don't, in fact, one of the teams we worked with, because there's literature on this, decided that they would get a name tag, because I'm going to tell a bit of an anecdote here. What are our name tags? I don't know where Fraser Health, what your policy is on name tags. At Providence Healthcare, we use our name tags that are also our security pass. So they're not very big. And we get them on an elastic piece, right? So that people wear them here or they wear them on their waist. So when we come into a room, and I'm going to speak as a physician, I come into a room and there's a healthcare provider, a nurse that I've met before, but I can't remember her name. The card is either on the chest or over the breast. So if I have looked once, I don't want to look the second time. Or they wear them on the groin, on the belt. So now what am I going to do? You've got to look over the station to actually see their name tag. And I want to do this so subtly that I don't have to feel embarrassed that I don't remember your name. And you won't see that I'm actually trying only to look at your name tag. So one of the teams we worked with actually decided, based on literature, that they would get name tags for everybody that would all be worn up here, and they would be the same. And people could choose. For me, it would be David, physician, right, or Dr. Kuhl, whatever people would choose. And that's one of the ways they actually wanted to stop the hurt. So, and excuse people who may not remember names so easily. So that is, and the other piece of that name game then is because we want people on teams that have worked together for a long time to begin to recognize that we're people first. And often people, even after that exercise, say, I never knew that about you. It's been very interesting to see how you got your name. So that's the beginning of what does a relationship mean. And it means that we are seen, heard, and understood. We also want to see, hear, and understand others. So that was the purpose. And then the other part is that most healthcare providers, as Hillary said and Linda said, is that we come to work because of a sense of calling, a sense of purpose, a sense of meaning. So that's why we invite people to look at that. And then the listening, what's it like to listen? Where you actually are putting your own story aside for a second because you simply are working to listen to the experience of others. And then what's it like to tell your story to somebody who's listening with complete intent? Eye contact, you're sitting at the same level, and we know that in terms of giving patients difficult news or difficult information. It's important to sit down. It's important to give them eye contact. It may actually be of value and importance to say, could I put my hand on yours because I'm about to have a conversation with you that might be courageous or challenging. So our goal through all of today is for you not so much to think about patients, but to think of yourselves. Who am I in the workplace? And then think of your colleagues. Who are we in the workplace? How do we want to be together in the workplace? And one of the teams we worked with actually asked that question. What do we want to be known for as a team, as individuals, as care providers? So that it gets to a level of understanding about the complexity of relationship, which leads us to the next exercise. But before I do that, the whole center piece in terms of the guidelines that Hillary talked to you about, in terms of today, with regard to people's sense of anxiety, you don't have to participate in anything that you don't want to participate in. That's the right to pass. And we believe that. It's not just a term on there. And any of the values, anything that we invite you to do, we function. We do that amongst the three of us. Our bottom line is keep the air clear and clean between us and amongst us. So that what that means is that if we feel, if the other day I called Linda and I said to her, I think the way I talked to you was offensive. I would also have to say to her, if that was true, my experience of our conversation was that the other day was that I felt offended. I felt hurt by it. Because we really want to practice what we actually ask and invite other people to adhere to. Working together to become teams is hard work. And it doesn't happen in a morning like this or in a day like this. But it gives us beginning of understanding of what this is. So we're going to lead you through a few exercises because at the end of the day, of our part of the day, our goal is for you, each table to have 3, 4, 5 areas that you could commit to. And we realize you're not whole teams, but we appreciate that there's, at most tables, people that are working together. That you'd have a sense of if you were the whole team, here's 3, 4, or 5 concepts that you as a team could commit to, that you would want to actually sign your names to if you could, or that would be part of your identity, and that you might revisit every few months to say, how are we doing? So that we're going to give you a taste of how we work with teams to get to those 3 values, the sense of purpose of how do we want to be together in the workplace, and how do we then want to provide that care and extend that same essence of who we are to patients and their families. And I forgot to say when I show Ian McWhinney's slide that it talks very much about patient-centered care. We actually talk about patient-family-centered care because that's the evolution of healthcare. So the next exercise in this segue that we're going to invite you to participate in has to do with, you've probably worked with people at your table for weeks, months, or possibly years. So if I was at your table and we had worked together for 5 years, what I want to know from you today is, what do you want me to know about your work that you come to every day? What do you want me to know about that work that would help me understand you? And this isn't about necessarily a task. Unless you're doing a task that you find particularly challenging or something you don't like, whatever you want me to know about you to help me understand you in the context of your work. There's probably many things, but we don't have time for that. So we're giving you a taste of how we would work with teams. So we're going to give you, we'll tell you when time's up, because after this exercise, you'll be ready for a break, and we'll be having a break. So.
It might be interesting just to ask how many of them work with people, but never get to actually meet them face to face.
Oh, okay, good question. How many of you work with patients or work with people, but you don't meet you're not working together face to face? Like if there's community workers and hospital workers, are there any tables like that? If you yeah, a few. Okay. If you're sitting at a table with people that you work with on a regular basis, put your hands up. So that's the majority. So the ones that don't work together, this would be particularly interesting because you won't know a lot. You may not know a lot about each other. Back to the exercise. What do you want the people at your table to know about you and your work that would help them understand who you are in the context of that work? Go ahead.